Sir, all risks of open surgery apply to robotic surgery. That's all, sir. The only difficulty in robotic surgery, adoption one, number of systems. The Da Vinci Xi we are talking about, there are only 110 robotic systems in the country. That is one problem. Second, cost. Third, all of us are used to, all of us learned surgery by feeling, correct? Not podrona, we know, drill pandrona, we know the depth, we know where it is giving away. So that haptic feedback or the tactile feedback is not there. The entire tactile feedback is now visual. So you can press the bone with the instrument. You will not feel it, but you know that your instrument is not going there. So that unlearning, relearning will take time, and that has a learning curve. Usually youngsters pick it up easy because we are all gaming generation, sir. So the learning curve is the only difficulty. Everything else can be managed, sir. Cost can also be in a successful system. For example, if you're running a successful robotic unit, which means by the definition at least 2 to 3 robotic surgeries in a day if you are able to do, the cost of robotic surgery will be equal to the cost of laparoscopic surgeries.
But how much time does it take for an operator to learn and start doing surgery?
Sir, company has its own definitions for all these. For each procedure, they have a learning curve. They say for somebody to do good robotic thyroidectomies, they say you should do at least 25 cases in your learning curve period to cross it and further excel. So for every procedure, there is a number, sir, depending on the complexity of the procedure.
Delivering the specimen.
Yeah. So.
You said you covered in plastic thing and.
Yes, sir.
Through the same 5 mm ports, how do you do it?
I will show you, sir. Through the same port, because it's a subcutaneous port, there is no muscle underneath. In the right axillary port, it's a subcutaneous port. We have given pneumothorax, we have given pneumo as well. So it has expanded a little bit. Now you can deliver the specimen as big as 11 centimeters also without extending any incisions through the same thing. It will come off. We never do tissue handling, sir. You would have seen the specimen. Specimen or a capsule, blood vessels, everything will be pristine. The reason is we never handle specimen. It is against the principles of oncology. So specimen dissect panni, just to do robotic surgery, specimen dissect panni, pirichi, padi edukkiradhu, spill pandrathu. This is all unethical beyond our discussion, sir. We never do that. Sir, so far 11, so far 11.5 centimeters has come out, so I'm happy with that. Beyond that, pandradhu kashtam, sir. See, huge tumors will be obviously stuck to the something trachea or internal jugular vein or carotid. So beyond that, we are also not too bold. Like I said, NM is not to do the robotic surgery. If patient problem varapodana, why are we going to offer robotic surgery? So
I know it's a more soft tissue equipment than osteotomy.
Yes, sir. For bone, orthopedicians have their own robots, sir. The knee replacements, hip replacements, for all those things there are bone instruments as well. While these soft tissue robots do not have an osteotomy instruments.
What is the comparative cost? If the cost of conventional surgery is X,
Sir.
how much is this?
Sir, for example, let's talk about thyroid. If a cost of open thyroidectomy is 2 lakhs, robotic surgery is going to cost you 3 to 3.5 lakhs. The difference will be 1 to 1.2 lakhs, sir. That is all.
Is there insurance coverage for robotic surgery?
So since 2017, it has been covered by insurance, and there is IRDA approval that nobody can deny. No insurance company has the authority to deny robotic surgeries. It is applicable. Insurance is applicable. Because a decade ago, this was seen as cosmetic surgeries. Cosmetic surgeries are not applicable in insurances. Now, over 2 decades of data made us understand, and the legislators understand, that the outcomes, functional outcomes, oncological outcomes are better than cosmesis. So cosmesis is the least indication. We usually offer surgery now, robotic surgery now. So the outcomes has surpassed, the data is mature. So now the governments understand that this is not cosmetic surgery. Robotic has benefit beyond cosmesis. That is why it has been taken off since 2017. Extremely minimal, sir. 10 ml, one patty is what we use, sir, in the entire surgery. That is all. Usually, patty is barely 2 by 3. 2 by 3 inch. With all this hospital stay decreases, cost of additional hospital stay, additional medications reduces. So that additional 1.2 lakh, how I justify it to the patients is, let's say we did open surgery. Let's say your parathyroids are gone. Now you are on lifelong calcium supplementation. மாசத்துக்கு 5,000 ரூபாய் calcium வாங்குறதுக்கு 1 year you are paying 60,000. In 2 years you would have gotten the money that you are going to spend upfront on robotic surgery. So it is how we talk, it is how we make the patient understand, sir. Thank you all.